Hello, I am Dr. Alpesh Choprani. I am the clinical head and chief cataract, refractive and corneal surgeon. I am doing LASIK and cataract and refractive surgeries in this hospital, Netradarshan Super Specialty Hospital, unit of Dr. Agarwal's Eye Hospital. Now, today's topic is what we are going to discuss is about LASIK and what are the advantages and disadvantages, who are eligible, what is the advantages of the LASIKs and who are eligible for the LASIK. Now, why we want LASIK, and important part is how many people are eligible for LASIK. Now new people generation are going day to day in LASIK. Why they want to do LASIK is they want to get more freedom from the glasses. Apart from that, they want to do lots of outdoor activities like adventures and all that. And definitely the self-confidence is improves after the LASIK. Now the first thing in the morning, what the person who does has spectacles, important is he'll have the spectacle next to his bed and also everyday activities. The important part is taking the LASIK to a next level. Now getting rid of the glasses is very important. Now why is this a good investment for a person to undergo a LASIK? Removal of glasses is one-time investment and that is important for the outdoor activities. So the dependency of glasses is gone out and definitely improves the self-confidence of this person. Now let me tell something about LASIK and who are eligible. Now we have some certain criteria for which you have to do a LASIK. First, we do a test. The numbers should be stable for at least 1 year. Important. Age factor is another factor which we consider. For 18 to 19 years is the stability of numbers. 18 to 19 years, there are chances that there could be a changes of numbers. So we advise them to wait for 1 year. Important after that, the eyes, how the condition of the eyes is been tested. So we know that there is some scans which we do. Important is the scan. Once we do the scan, the answer is yes or no. For that, if they are eligible for LASIK or not eligible for LASIK. If they are not eligible for LASIK, there are different procedures for getting the numbers removed. And there are like ICL, and there are refractive lens exchange which can be done with numbers, very high numbers also. We have operated up to -24 also, where we have got rid of the glasses. Now it's very important to make a decision to do the LASIK. Now few factors which you consider for doing a LASIK is the freedom from glasses, change in lifestyle and the personal preferences we do consider. Points to make the decision is few things: whether that you are eligible, the cost factor and the potential risk involved in this LASIK. So a doctor is very well, after doing the evaluation, is important for the doctor to decide whether the LASIK is suitable for you or not, or there are other options. Okay. Now we have people who undergo LASIK with us and they have gone to army, and if girls who are getting married want to get rid of glasses. Okay. They are good candidates provided they fall into a proper profile. Okay. Now what is LASIK? First of all, you should know about LASIK. LASIK is a cosmetic procedure. We don't have to be frightened of LASIK. It's a safe procedure, one thing. Other aspect what we consider is it's a cosmetic procedure and one-time removal of glasses. If there are some numbers left behind, we can do a top-up LASIK also and get rid of that numbers also. Now what is a LASIK? Is laser in situ keratomiliosis. Okay, that is your numbers are fed to a computer and the laser has been decided by the computer. My job is to focus on the eye. It takes around 10 to 15 minutes for each eye. So by the 20 minutes you are away from the glasses permanently. Once you have little irritation, pain, watering and all that in the eyes after LASIK, that lasts for just 24 to 48 hours. But the advantage is lifelong, no glasses and all that. Only what you will have is after the age of 40, which you have reading numbers. That is very common after at the age of 40. You will have plus numbers, that is plus 1 at 40, 45 it will be 1.5, 50 it will be, and so on so on. There has nothing to do with future procedures or this like cataract or this does not influence. This LASIK does not have any contribution to all that. Other aspect what we see is a dryness of the eyes after the LASIK, for which we give some drops that is needed for around month and a half to take for the patients, so that they have lots of dryness and irritation, for which we give substitute with the drops. And that's not only for it's not for the lifetime, it's for 1 month, 2 months, that's all. And we regularly check the patients. Other aspect, when you consider the LASIK, like LASIK has three different varieties. One is epi-LASIK, PRK and the LASIK Prom. We raise one flap in the conventional LASIK, or we instead of flap we can directly apply LASIK. That is a next generation LASIK, that is a transepithelial PRK. That can be done and we can remove. If the cornea is thin, then transepithelial LASIK can be done. Now let me come to a personal story of what I have experienced in few cases. Patients are very much frightened of doing LASIK because they feel that something is different and some doctor is going to play with the eyes. Definitely it's safe procedure provided we have a profile of the patient and the personal needs of the patient. It improves definitely the self-confidence of the patient. Now considering like few patients who are had high glasses number like -3, -4, okay, and patient went for a picnic and was not able to see because there was no glasses, because he forgot the glasses at home and he could not enjoy a picnic because of -3, -4 numbers. So he came to us to get rid of these glasses, and that made we made them free of glasses, and now the patient is very happy and he can wear even sunglasses out a color contact lens over that. That is main important of getting LASIK. And other aspect is some patients do come to us where they want to get married because they have a phobia of doing a LASIK beforehand. So they want to get rid of these glasses but without any pain. So painless, bloodless, this LASIK can be done. Other important story is I have done LASIK for my wife. She had -3 and -3.5 numbers. She is getting free of glasses, and that is very important for me because at that time when I was doing her LASIK, my hands were shaking and I had literally what will happen after LASIK. But today she is happy with me. Only as she is cross 40, she is reading numbers is definitely for her. Okay. Thank you. And it's quite safe. LASIK is quite safe. You can all come with lots of queries and things to come. All the queries can be taken up. We have a webinar coming Saturday where you can join to me on web and ask the queries.